Well, hi over there. Hey, welcome back to San Diego Living. Now, I went out and did a little run on Sunday and ran a little harder than I usually do just to kind of, see where I'm at physically. Guess what? Came up with a little bit of big toe pain when I was done. Well, I knew Dr. Krage was going to be in today, and I knew he was going to want to talk to me about it, so I just saved it for today rather than calling into your office. Dr. Krage, the Happy Feet program here, helping folks out all over the United States now with the Happy Feet program.
Well, Mark, it's great to be here, and frankly, as you were running around the track, fact is, your body has to absorb, and your feet particularly, the 26 bones on each side, have to absorb 3 times your body weight every time you go from heel strike to toe off. Now, if you have pain on one side, Mark, that means that the foot on that side is actually collapsing. I have a model of something right here, if we could actually show this. So this is what we call a pes planus, or a flat foot. Okay. Now, whenever this happens, this is the beginning stages of several things that take place. One is called plantar fasciitis, which means tearing of this tissue. The big toe, which then starts to break down because you're putting too much friction into it. And subsequently, then you can actually get neuromas between each of those toes. Now, any of you are having suffering from those types of pain right now, this can all be eliminated before it turns into a destructive phase.
And it can get worse, and that's the thing we want to talk about. So if you're experiencing any kind of foot pain, folks, and if you can look down, especially if you can see maybe the toes starting to turn a little bit funny and not be as straight as they used to be, bad sign. But now Dr. Krage wants to see you. So for the first 25 callers, absolutely free, he'll give you an exam and then also give you 2 free laser treatments. This is non-surgical, non-invasive. The whole idea is you want to avoid these truly invasive and pretty drastic surgeries that fail at a pretty high rate.
Well, the sad part about it is we keep putting our feet in those shoes where they're not supported, just like yours, okay? And if you continue down that road, it's just like a car that's out of alignment. You're going to wear those tires out.
And it's not just the tires, though. Other things start to happen.
It goes to the knees. It goes to the spine. Many of these things actually cause the breakdown. We can actually have 50 other problems in our musculoskeletal system strictly because of bad feet.
So, folks, you see it on their screen there. For the first 25 callers, absolutely free. A free exam and 2 free laser treatments. And we'll talk more about the laser in a moment, why that's so important. But again, it's non-invasive. You're not being cut by a laser. Your foot is being warmed, and the healing process speeded up. Now, the woman that we were looking at there just a few moments ago obviously has some problems there. Okay, her right foot, left side of the screen, but her right foot really looks uncomfortable. I mean, the toes are bunched up, and one of them sticking up in the middle. So what's wrong with that foot?
This would be like you not coming in too early enough, okay? So this person has already had 3 failed surgeries, Mark, on the right side. The hammer toe surgery, bunion surgery, and neuroma surgery. And the sad part about it is that all could have been dealt with beforehand if they would have come in earlier, okay? Now, she's a teacher. We want our teachers feeling good teaching my kids, okay? So it's really important that you address those issues before they start to break down. The takeaway of all these pictures that I show you, all this could have been stopped if you'd handle these things beforehand. So if you're having any of that toe pain, the bunion's starting to bend, or there's plantar fasciitis, please take advantage of this.
Again, folks, as he says, take advantage of it because it's absolutely free. The free exam, the 2 free laser treatments to speed up the healing process, and again, non-surgical. Now, the surgeries are, again, they're pretty drastic in some cases. I mean, you've shown us examples where they've gone so far as to remove an entire toe.
Absolutely.
Trying to solve the problem. And you say, in many cases, even that kind of surgery fails.
Well, here you're looking at a lady. This lady is 78 years old. Now, what you're seeing here is a very ugly foot, frankly, but all this could have been obviated. All you have to do is do the right mechanisms. We deal with the underlying problem, kind of like the alignment of a car. We understand exactly what's going on here to create that bunion that you see there, and we can stop those pressures so you stop producing it. We actually had a young lady come in yesterday. She was only 9 years old, and she already had bunions. Now, in her case, it was primarily because there's a genetic predisposition for that. But you can stop that, too, so she doesn't want those to turn into what her grandmother, she said.
And I know you've really talked to me a lot about the shoes being too tight. And this is guys. We're talking about shoes being too tight. Women, the problem is drastically exacerbated because of the high heels.
Probably 60%, 70% of our folks are female patients, and frankly, they look so pretty in those shoes, but guess what? It causes an improper gait, and it destroys the forefoot. So ladies, you know, get your man, but get out of those doggone high heels. Or let me put it a different way. You can look hot at the party, but afterwards, golly sakes, let's get into things that keep you healthy. I'd much rather hold hands with my wife till I'm 100 than to, you know, be pushing around in a wheelchair.
Be able to take a walk together.
Yeah, let's
absolutely.
have some fun.
All right, first 25 callers, again, and if the phone is busy when you call, please continue to call because they'll get you just as fast as they can. But the first 25 callers, it's absolutely free at an exam and then the 2 free laser treatments. Explain why the laser is so important.
Well, we have now 5 class 4 lasers in our office, and these are the strongest lasers in the world. We're the first in San Diego to have this DioWave 30-watt laser. Now what you're seeing here is a light beam. That's all it looks like, but frankly you can feel this deep penetrating heat all the way into those pathological tissues of neuromas, plantar fasciitis, and the bunions. We have people that get off of these tables and actually indicate they're 50% better in just the one treatment.
They feel that much difference just after one treatment.
That much different. And you actually see the toe actually start to move better. That's like greasing the joint. You'll actually see it move as much as 30 to 40% better with just one treatment. Now, the point is that this light beam penetrates those cells and increases the healing process by about 4 to 5 times normal, which allows us to get these people healed up on a much faster pace.
So, folks, again, the number that you're seeing on your screen is absolutely no risk, no obligation to you. The only thing that I would ask, because I know how busy Dr. Krage is, if you make the appointment, keep the appointment. That's all we ask. It's absolutely free. 2 free laser treatments, the exam, and a lot of folks walk away from that feeling better and absolutely convinced, boy, that's the road they want to head down and not what they were on prior to walking into the office. You've got these webinars now, and this is at happyfeetlaser.com. Folks can go and they can actually get a lot more information and sit and watch, you know, a little bit more in more detail than what we've been able to go into.
And you'll get to meet Roger Hedgecock, who's also a client of ours. You'll get to see about his story as well. So you have a chance to really, you know, in this particular time frame here, we don't have a chance to really tell you everything. You'll get to hear people that have already gone through the program and how it's changed their life and got back on track. You'll understand exactly everything that we do in the office to allow you to get better. And then you'll get a chance to also get in to see me personally, and we'll make sure that you got happy feet.
Happyfeetlaser.com is the site. You can go check the webinars out. But again, if you'd like to go in and see Dr. Krage, absolutely free. Get the free exam, the 2 free laser treatments. That's a $350 value, and the doctor is offering it absolutely for free. And hopefully, you know, he's able to help about 90% of the people that come in. Hopefully, you're in that 90%. If not, he will direct you to the next best alternative for you.
Just take action now. I'm tired of all these people coming in with these bent toes. If they want them better, they can. If you just get up and take advantage of this, you can get better now.
Get to the phone right now and make the call. Okay. For more information, you go to san-diego6.com and you click on San Diego Living. It's Dr. Krage. Happy feet.